People may think of ENT as just a finite specialty where you get your tonsils out, you may get your thyroid out, but I think people would be shocked to know how many things are related to the ears, the nose, the throat, the neck, the breathing, the sleeping, the hearing. Sleep disorders, as you may have heard, can lead to sleep apnea, where you stop breathing when you sleep. And that can cause high blood pressure, can cause strokes, it can cause heart rhythm problems, can make you fall asleep driving a car and get in a car accident. That hearing loss that grandma has may lead to dementia, can lead to social isolation. You may have been in a party where there's an older person sitting in the corner because they can't hear, so they don't participate in the conversation. Or sometimes they're the most animated person in the room, but what they're not doing is they're not hearing anybody else, so they're talking over everybody. And then breathing through your nose. You think it's such a non-important thing. You know, you're taught to breathe through your nose and out through your mouth when you are in elementary school, but there's things in your nose and therefore the air going from your nose to your lungs that could impact exercise performance, endurance, and other things like that. One of the other common things is either acute sinusitis, meaning a sudden infection that you didn't have last week, or chronic sinusitis, something you've been dealing with for months and months and months. Well, that can lead to time off work, lost wages, depression, anxiety, fatigue. And I'm not quite sure that everyone knows when they should be seen by an ENT. You know, that person who has that heart flutter, maybe they weren't told that maybe they have sleep problems and sleep apnea. Or that 75-year-old person that puts on an antidepressant, maybe they didn't realize that person really couldn't hear, and that's really why they're withdrawing from life. Or that employer who fires you and you don't really know why, but you've missed so much work, or you're underperforming because you have chronic sinusitis and you just don't feel good. So I think there's a lot of diseases, problems, issues that are related to the ears, nose, and throat and related structures that can cause significant quality of life issues. And sometimes if your primary care doctor that's not their first thing they're thinking of, maybe the patient needs to think about it.